St. Louis and I are here today in support of genuine transparency, accountability, and oversight in our federal prison system. Director Peters, as you know, you oversee a key component of our federal system of mass incarceration. You are responsible for the conditions faced by nearly 160,000 incarcerated people and 35,000 staff members. Right now, we understand our prison system needs a lot of work, it needs help, and for many, many see it as a disgrace. I want to touch on a couple issues in this limited time that I have. First, I want to say thank you for the work that you have done and for what you are trying to achieve. I know that it isn't easy coming into and trying to change a system that is already so broken. But I am deeply concerned by what we hear about oftentimes is the pervasive medical neglect of incarcerated people and those who have reported month-long wait times for doctor's appointments and routine procedures, retaliation from staff, and fear when seeking medical care. Several deaths may have been preventable, had proper medical care been provided, and this issue is personal for me and my constituents because right now we are facing some of the same issues at the St. Louis City Justice Center. The Bureau must overhaul its approach to providing medical care for incarcerated people and set an example for local carceral facilities in St. Louis and around the country because we look to that to be able to go into our local jails to be able to say, this is what should be done, this is the example. The other issue I want to address is solitary confinement. It is shameful that solitary has increased in the Bureau during the Biden administration, despite the president claiming he supported ending it. Director Peters, you have repeatedly recognized the harms of solitary and the need for holistic rehabilitative alternatives. You and I both know that solitary causes devastating harm and it worsens safety for everyone involved. It drives anxiety, depression, psychosis, heart disease, self-harm, and suicide. And I know you know this from even before in your background before you took this position. And we also know that environments that are the exact opposite of solitary involve program-based interventions with full days of out-of-cell time and how that actually help both support people's health and it makes everyone safer, even the staff, because we also care about the staff. So instead of taking action on this issue based on the overwhelming evidence, the proposal of further studies, can we talk about that? Isn't it true that we don't need yet another study, but rather an urgent action to replace solitary with proven alternative forms of separation?
Congresswoman, first I'll address your health care issue. I want you to assure you we want to be the model. And as we pivot out of the pandemic, we're working through our backlog of that preventative health care that happened at the Bureau of Prisons just like it happened in our communities. And we have secured a contract with an external group of experts who are going to come in and do a quality assurance of our health care and help us create that future vision where we can be the example. As it relates to restrictive housing, I want to move as fast as you do, Congresswoman, but I also know that we have to bring our people along, and I don't want to take a tool away from our correctional officers today without replacing it with a new tool tomorrow and with that training to ensure their safety. So we do have a short-term plan and a long-term plan. I think you'll be pleased to know the short-term plan is first, we ensured that all the recommendations that have been brought to the Bureau in the past have been implemented. And then our group of experts have traveled across the country to get best practices from other systems and bringing it back. We're actually meeting next week as an executive team. We will review those recommendations and get moving on that work. And then the partnership with NIJ is historic, Congresswoman. It's the first time that the Federal Bureau of Prisons will have an outside entity come in and take this global of a look at our restrictive housing. You and I share the same values. The more normalized environment we can create for the adults in custody, the better outcomes they'll have in the community, the fewer victims that will be created, and as you said, and most importantly, a better work environment for our people.
Thank you. Looking forward to that, and our office will be in contact as that moves forward, and I yield back.
Thank you, Congresswoman.
Thank you, Congresswoman Bush.